For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Lung cancer is one of the leading causes of death in the United States, and November is National Lung Cancer Awareness Month. So today we have 2 guests here to talk about a new screening that's available for people to detect lung cancer early. Our first guest is Dr. Andrew Stone, a radiologist at St. Tammany Parish Hospital. Welcome, Dr. Stone.
Thank you.
I guess first, can you give us a little bit about your background, your schooling, and what got you into radiology?
Well, I'm originally from North Louisiana and West Monroe area. I went to LSU for undergrad and grad school, and then eventually to LSU Medical School in New Orleans. After completing an intern year, I did a 4-year radiology residency in Oklahoma City, and then went to Baylor in Dallas for a 1-year fellowship in body imaging. A lot of what I did during fellowship was oncologic imaging of all sorts, really, but we did have a focus at Baylor mainly on liver imaging and lung imaging. So once I got the job at St. Tammany, then I thought it would be good to focus on oncologic imaging.
Okay, awesome. Well, I guess, can you explain the low-dose CT lung screening program and what that is?
It's a program designed for individuals that are at high risk for developing lung cancer, such as people who smoke or have quit smoking recently within the last 15 years. Other risk factors for smoke, or for lung cancer, include specific occupational exposures, radon exposure, family history, or history of pulmonary fibrosis or COPD. There was a screening trial called the National Lung Cancer Screening Trial, which showed a 20% reduction in lung cancer mortality and a 6.7 decrease in all-cause mortality when low-dose screening CT was utilized in a certain population.
Okay. And so what are the benefits of this lung screening?
So one of the keys to treat lung cancer is early detection. Often lung cancer is detected in later stages when it has compromised the function of one or more vital organ systems or is spread throughout the body. As we discussed earlier, mortality for all causes, including lung cancer, were shown to be decreased with low-dose CT screening program.
Okay. And so are there guidelines that people need to meet to qualify for this screening?
Certainly. So individuals that are high risk and recommend to be screened include people that are ages 55 to 77 who are currently asymptomatic. They do have a tobacco smoking history of at least 30 pack years. So an example of that would be 1 pack per day for 30 years. Or somebody who is a current smoker or has quit smoking within the last 15 years. Also eligible would be people who are 50 or older with a smoking history pack of 20 years or more, with one additional risk factor other than secondhand smoke exposure. And some of those include radon exposure, occupational exposure to asbestos or other carcinogens, a personal cancer history or a family history of lung cancer, or disease history such as COPD and pulmonary fibrosis that we talked about before.
Okay, a minute ago you used the word asymptomatic. Can you explain what that is? I know it's more of a medical term, and I know we hear it all the time, but I think for some viewers, they might not know what that means.
Absolutely. So if you smoke and you're currently very short of breath, like you have a symptom from your lung disease, then you're not eligible for the screening. You would almost have to go see a pulmonologist or your primary care physician and be worked up for an actual active disease process.
Okay.
So people who are eligible for screening do not have active lung disease processes.
Gotcha. So they don't have any symptoms yet, but they think because they've smoked or something like that,
Correct.
that they could develop.
Correct. They would be put into the program because of risk factors only, not current illnesses.
Okay. And then can you tell us a little bit about how the test and the screenings is performed?
So it is a CT scan. So it isn't a conventional CT scanner. And what we do is we use a spiral CT we use different parameters that lower the dose from a normal diagnostic CT scan to take images of your lungs. The CT scanner rotates around your body while you're on the table that passes through the tube. It takes about 10 to 15 seconds and is normally done in a short breath hold. There's no need for any contrast, so you won't have a needle stick and be injected with anything. Once the study is done, they will be sent to the workstation where the radiologist will review the study, and then based on what we see, we make a recommendation that were developed by the American College of Radiology using the National Lung Cancer Screening Trial results. And normally when you have your screening exam, we will recommend a follow-up screen in 1 year because you still have the risk factors. Or we'll recommend more advanced studies because we see something that is of concern to us.
Okay. Can you explain a little bit more about what it's like to get a CT scan? Because I've had an MRI before, and that's a little scarier because you're kind of inside a machine, but a CT scanner is a little bit more open and not as confined, I guess.
Certainly. They look similar. So they're both sort of donut shaped with a table running through the middle. When you're getting a low-dose CT of the chest, or any CT of the chest, abdomen, or pelvis for that matter, you'll lay on your back on the table. The table moves through the CT machine. There's not much noise. MRI is very loud. And then it's 10, 15 seconds. Like I said, with this study, there's no contrast involved. Other CTs there are. And it's literally you hold your breath, go through the machine in 10 seconds, and the study's over.
Okay, so it's very, very easy and not
Very
real.
easy.
It's not scary if somebody's claustrophobic or anything like that.
Most people do not have any problems with even claustrophobic people in a CT scanner.
Okay.
Some people who have really trouble lying flat on their back, that can cause some shortness of breath in itself. But again, this study is very short compared to a normal diagnostic CT.
Okay. And so do those enrolled in the screening program need to be concerned about exposure to radiation? I know we're saying it's low dose, but it's still something.
Yes. So again, we change a lot of the parameters on the machine to generate a low dose of radiation during this short scan. And when we use this technique, the amount of radiation is so reduced compared to a normal CT that the decreased mortality that is shown in the National Lung Cancer Screening Trial greatly exceeds the risk of radiation in this small exam when used appropriately in the population that is appropriate for screening.
Okay. And then can you talk a little bit about what would happen if something is found? Are you then recommended to go somewhere else, or?
So on a screening exam, there are about 4 or 5 different outcomes from what I would see if I was reading the study. You can have no nodules, and that's what we're looking for, nodules or masses in your lungs. But you're still qualified for yearly screening. Or you can have very small nodules and the follow-up is the same. Once we start finding more suspicious things, then you can either be called back for a short-term follow-up, like a 6-month low-dose CT chest, or when we get into the larger masses, we can even move on to a diagnostic CT, perhaps even a PET CT. It's all according to what we find. The majority of people who, the high majority of people who get this screening usually just have to follow up within a year. But the point of getting the screening is if we do see something suspicious, yes, we will immediately move on to more advanced imaging techniques and follow up with the appropriate providers.
Okay, so it's things that can be monitored, and it's not always automatic, you have lung cancer.
Absolutely, and I would advise also if you enter this program because you have the certain risk criteria, even if you have the first normal scan, it's screening for a reason. It's
Right.
not, hey, I had a normal scan, I'm good, I'm done. You need to follow up with the recommended like yearly screen until you reach the age where screening is no longer recommended based on the trial.
Okay, so it's similar to a mammogram, but it's not something that's been around as long to.
Absolutely.
So we're trying to.
Yes, the screening process is Absolutely the same. It's the same premise, just like screening for any type of cancer, because we want to catch it early.
Right, because early detection saves lives, right?
Absolutely.
I guess one more thing, what can people do, I guess, to decrease their chance of being diagnosed with lung cancer in general?
Well, quit smoking is the main thing. There's in 2017, there's certainly no doubt anymore that smoking results in lung cancer. And St. Tammany Parish Hospital does have a smoking cessation education program. It's offered at various times during the year.
Okay, awesome. Well, thank you so much for being here with us, and I appreciate you sharing information about this screening, especially since it is so new and it's something that we really need to make sure people know exists.
Absolutely. Thank you so much.
Thank you. We'll be back with Lori Chopin from St. Tammany Cancer Center to talk a little bit more about low-dose CT program and how people can get the screening.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Lori Chopin from St. Tammany Cancer Center, here to give us a little more information about low-dose CT screenings. Welcome, Lori.
Good morning.
Can you tell me a little bit about what you do at St. Tammany Cancer Center?
Yes, I'm the coordinator for the low-dose screening program.
Okay, so you kind of coordinate all of this.
I do.
Perfect. All right, so what does someone have to do to get the low-dose CT screening?
They're going to have to visit with their doctor and get a physician's order to have that low-dose CT screening performed.
Okay, so it's not something that you can just call and self-refer?
No, unfortunately they can't. With their visit with their doctor, they're going to have what they call a shared decision-making visit, where the physician's actually going to review the risk and the benefits of having the low-dose CT screening.
Okay, and what type of physician? Is it just their primary care? Do they need to go to some sort of specialist?
Usually their primary care physician is the one that can order it, but I think pulmonologists also order it. So if they're under the care of a lung specialist, their pulmonologist can also order it.
Okay, perfect. So it's something that they should just mention to their physician when they go for their visit?
Yes, definitely.
Okay, and then does, I know a lot of people are probably worried about the cost. Does insurance cover it, or is it something that we can offer?
Yes, insurance is now covering it. Back in 2016, the Centers for Medicare and Medicaid have agreed to cover it based on what the United States Preventive Task Forces had to say about it. And they recommend that people get screened for lung cancer because with the earlier detection and the earlier diagnosis, the better outcomes people have.
Okay, so that they determine that it's worth paying for to get.
Yes, right.
I feel like that says a lot about the importance of it.
It is very important, and now insurance companies, private insurance companies, are also paying for the cost of that. And if people don't have insurance, we also have a cash pay price that people can also pay.
Okay, perfect, because it's so important to get it. And like Dr. Stone said, you're supposed to get it annually once you start?
Correct, yes, as long as you meet the screening guidelines, which I think he reviewed was the ages of 55 to 77. People are eligible unless they reach their out-of-pack years, which is 15 years. If they quit smoking 15 years prior, then they run out of the screening guidelines also.
Okay. And where does this happen? Is it convenient for people to get? Do they have to go to the cancer center, or where does it?
The screenings are performed at the Outpatient Pavilion on Highway 1085 in Covington, so it's relatively close to everyone in our community.
Okay. And do you make an appointment, or is it something that you just walk in for?
No, appointments do have to be made for this because it is a special procedure. But after the physician orders the test, then I get a copy of those orders. I contact the patient via telephone call before the scheduling is done, just to review the criteria with them, make sure they're eligible for all the screenings before it's taken place, and then I give them the name and the phone number for the schedulers to make that appointment.
Okay, and then after it's done, how fast does it take to get their results? Do they need to go back to their physician for that, or how does that work?
The results are really timely. We get them back within a week usually to the doctors, and if patients have any questions, they can certainly follow up with their physicians. But in the meantime, I also send out a letter to each participant, letting them know what their score is on that screening.
Okay. I guess, can you give us a little bit of kind of statistics about lung cancer? Because I know, everyone knows lung cancer and they just assume smoking, but I don't know if people realize how high, you hear more about breast cancer, or you hear about heart disease, but lung cancer is very...
It's very prominent. I think it's more prominent than most people would care to think. Okay. It's actually the most cancer diagnosed in the world.
Oh, wow.
More people die of cancer each year than breast cancer, prostate cancer, and colon cancers combined.
Wow.
Yeah.
You would not...
No, you
That's
wouldn't
not
think.
what you would think.
Most people would think breast cancer kills most women and prostate kills most men, but that's just not the case.
Okay.
Lung cancer kills more people each year, so
Okay.
get screened.
Right, definitely. What about the risk of developing? Like, how common is it in men and women?
Well, usually 1 in 13 men will get it, and 1 in 16 women will be diagnosed with lung cancer in their lifetime. So it's pretty high.
Right. I would never have thought that it was that prevalent. And is low-dose CT screening, is that the only way that people can get screened, I guess, early detection before, as Dr. Stone mentioned earlier, asymptomatic before they have symptoms? I know we mentioned mammograms. That's kind of the norm now. Everybody knows, you turn 40, you start getting mammograms yearly, but this is a newer method. Is this the only way to get early detection screenings?
Yes, actually it is. And like Dr. Stone said, once you get your first screening done, there's going to be a recommendation by the radiologist whether to come back in a year or 6 months if additional findings are needed. So we do encourage patients to come back annually because it is a program that they're in. It's not just a one-time thing. So they do need to return annually and get the orders from their doctor and then go to the outpatient pavilion and have the test done.
Okay. And then Dr. Stone mentioned smoking cessation. Can you tell me a little bit about that? I know the hospital does offer it.
Right. Yeah, the outpatient pavilion the tobacco cessation program is held actually at the outpatient pavilion, but we do offer classes intermittently, and the first program, or the first session, is one-on-one, where they'll meet with a respiratory care practitioner and or pulmonologist staff member, and actually there are tobacco cessation specialists that have been trained specifically on how to help people quit smoking. Right. So that's a really good thing that we have to offer at the hospital as well.
Right, and that's important, since that's one of the main ways to help prevent lung cancer, as Dr. Stone mentioned. Okay. Well, if people wanted more information about the lung screening program, how can they get that?
They can give me a call at 985-898-4581. That's the Cancer Center's phone number for the Patient Navigation Office. Okay. And I'd be happy to talk with them about that if they need more information, or they can contact their primary care physician and talk to them about the low-dose CT screening of the lung.
Okay, and as we mentioned earlier, that should probably be their first step, is to talk to their primary care doctor.
Definitely, yeah.
Okay, great. Well, thank you so much for being here.
Oh, you're welcome.
I'd like to thank Lori and Dr. Stone for being our guests today and telling us about this important screening for low-dose CT for lung cancer. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.